Hi, I'm Dr. Kerry Gelb, and welcome to Open Your Eyes, your source for everything you want to know about eye care.
What's really amazing about being on the front line of ocular disease, whether you're an ophthalmologist, optometrist, eye care provider, being on the front and allows you the opportunity to see things in the eye that, that represents or reflects your general health, your overall health. And so by treating the eye, by making somebody's eye health better, by making their vision better, you're actually making their overall health better, because the eye is just a small organ that reflects what's going on systemically. And so you're able to systemically change people's entire health by making their vision better. Because if you do things like, and you help people improve, let's say, their macular health by increasing the lutein and zeaxanthin levels, or these chemicals that people use, these supplements that people use to prevent and to help macular degeneration, that is actually helping your systemic health. So you can improve somebody's dry eye disease if you identify that they have dry eye and you figure out why they have dry eye. Often it's a systemic problem. Dry eye is a systemic disease that manifests itself in the eyes. And so by making their dry eye or improving their dry eye, you're actually helping their overall systemic disease. And that could be, for instance, that you need to be supplementing with more omega-3s or fish oils, which we do know helps with dry eye disease, but it actually has systemic benefits as well. And that's what's fascinating about being on the front line as an eye care person, as an eye care professional, that you get to see the disease that nobody else can see. You get to diagnose that disease, and then you can actually start fixing that disease, which, by the way, goes back and actually fixes and enhances their overall systemic health. So what I tell my patients and what I tell people is that by improving your vision, by improving your ocular health, you're actually improving the systemic health. And that can only occur in the context of somebody who actually knows about the eyes and can see disease in the eyes. It's a phenomenal ability. It's like a superpower to be able to see real disease, actually look at disease in the back of the eye, in the front of the eye, all aspects of the eye, and to be able to tell somebody, hey, this is a manifestation of, for instance, hypothyroidism or high blood pressure, a hyperlipidemia, cholesterol. All of these diseases, in many respects, manifests itself in the eye. You can see it first, and often they'll come in with an eye problem. They'll have a systemic disease. They don't realize it's a systemic disease because it's just bothering their eyes. And you, as an eye care professional, as a frontline eye care professional, especially the optometric community, you're able to identify it, and then you can alert that person that they need to be more mindful of different aspects of their health. And a lot of times, because of our medical system today, where people do not have the time to spend with patients to really uncover these things, a lot of these important details actually fall through the cracks in medical care. And so as an optometrist, as a frontline physician, you're able to delve into these problems in a way that doesn't seem to occur in other aspects of medicine. And then you can understand and really understand what the aspects of the general health and how that's affecting the eyes. And then you can, as I said, by affecting and improving the vision, by improving the eye health, you're actually improving the systemic health. It's like a Trojan horse entry into their overall health. There is no place in medicine where you could actually look at disease as directly as we can in ophthalmology and optometry and ocular disease. What's fascinating is that by looking in the back of the eye, looking at the retina, we can see the smallest blood vessels that are in your entire body. And remember, the blood vessels that you see in the back of your eye show up everywhere. You can't see that in your brain, you can't see it in your kidney, you can't see it in your heart. You have to obviously do more invasive things to look at that part of the body. And we can actually see it. We can actually look at the blood vessels and we can say, hey, you have high blood pressure. It's so obvious. Your blood vessels are narrowed. Or we see cholesterol, effects of cholesterol emboli, which is like a little platelet, a little plaque or something that can come off of your carotid, can go into your eye. We can see that in the eye. Dry eye, we notice aspects of the front of the eye. We can see it. We can actually see disease. Whereas other physicians and other doctors have to do lab tests. They have to, in some cases, actually open you up to see disease. We can do it just through a simple eye exam. And the eye exam is not simple. It's very complex in what we do. There's a lot of behind the scenes thought process that goes on when we look at the eye, when we look at the disease, when we see the different organs, and we can then come back and look and bring that back to what's going on. I mean, it's pretty amazing that I can look at your eyelid margin and I can say, my God, your diet you're deficient in XYZ food. You're deficient. Did you know you're deficient in your omega-3 level? Or you're not eating enough fatty fish? Or you need to eat more of this, or you need to eat more of that. Isn't it amazing that I can do a test and look at the back of your retina and say, my God, you need to eat more spinach. Your vegetable content and your diet is low. We could do that. We have the ability to do that in these optometry and ophthalmology and ocular offices. We're able to assess disease states that no other physician can actually do. The other thing that's remarkable, which is now coming out, is that you are able to look at the microvasculature of the retina, and it can tell you things like whether this person is starting to have dementia. I mean, that is a phenomenal event if you think about it. There was recent studies have shown and uncovered that the microvasculature in your retina actually starts to die off and go down when you have dementia, especially Alzheimer's dementia. And this is a remarkable, so imagine going into your optometrist's office, ophthalmologist's office, and they tell you there may be signs of dementia. And that is something that nobody really, to be able to do that is such a superpower in some respect. You can gain so much information. So the thing that's amazing about looking in the eye is we can see evidence of multiple sclerosis. We can look at the optic nerve and you can see swelling of the optic nerve. As I mentioned, you can also see pupillary changes. Just looking at how light your pupil responds to light can tell you whether or not you have multiple sclerosis, or can identify that, because it can identify it based on dysfunction of the optic nerve. You can see things like cat scratch disease. Amazing that you can see cat scratch disease in the eye. There's a conjunctivitis, okay, that you can get, and that conjunctivitis, red eye, can mean that you have cat scratch disease. That can also show up in the optic nerve. You can actually see swelling of the optic nerve from cat scratch disease. Okay, super interesting. The other thing that you can do, which is amazing, is that Lyme disease can manifest itself, okay, in the optic nerve. You can see changes. And sometimes Lyme disease can also show changes. It can actually cause changes in how your eye moves. Some people actually will get an eye movement disorder from Lyme disease. So there's all of these systemic diseases that show up through the eyes that you don't need to do fancy testing. You don't have to go in for hundreds and millions and trillions of dollars worth of tests. Sometimes it's just doing a very careful exam on the eye, and you can pick up these things. The skin around your eye shows so many different diseases. The color of your eye. Obviously, people who have liver disease will get yellow eyes. They'll get jaundice. They'll get icterus. Their eyes will change color based on different liver disease. I mean, that's crazy. You can see copper disease. You can see too much copper deposition in the eye. Okay? You can detect cardiovascular disease. What a really interesting one is that if you have one of the blood vessels that supplies blood to your brain and your eye comes up through your neck, the carotids. And if one of the carotid actually is narrowed, you will see deposition of cholesterol in one eye and you won't see it in the other eye. And so you can see differences based on just you can clue systemic disease from really some things just looking at the color, the deposition, different things in the eye. You can see signs of significant neurologic disease. You can pick up, believe it or not, from a very simple eye exam, you can pick up lung cancer. And it turns out that lung cancer can affect, especially when it's in this part of the lobe of the lung, it affects nerves that are in this part of this part of your nerve plexus. Those nerve plexuses travel up through your neck and actually can change your pupil size and your eyelid position. I can look at somebody and I can see that their eyelid's going down and their pupil is small. It's called Horner's disease, Horner syndrome. I can detect lung cancer from Horner's disease. And that is not with anything other than just looking at them. The other thing I can detect is obviously we can detect evidence of brain tumors. I mean, those are very interesting diagnoses that we can detect. You can detect it through pupil size. You can detect it through double vision. Meaning that the eyes don't work together. And you can also detect it through the eyelid being droopy. Isn't it amazing that when you look at somebody and you see droopy eyelids, you can say one droopy eyelid, just one eye, and with their eyes going out, that alerts you, hey, this person may have a brain tumor. They may have an aneurysm pressing on, a blood vessel, aneurysm pressing on their brain. Just from looking at the eyelid, just from looking at the pupil, just from looking at their eye movement, okay? I mean, I don't even want to talk about syphilis, but yes, you could detect syphilis very easily in some respects. It shows up in all parts of the eye. Another one that's fascinating is all sorts of infectious diseases you can see in the eye. So many things you can detect through looking at the eyes. Everything from infectious diseases to your cardiovascular health, to your diet, to your exercise. All these aspects of your health you can see through the eyes. And sometimes it's as simple as just looking at the pupil size and how the pupil responds to light, or more complex where you can look at the back of the eyes. And you can use either really simple technology, just a flashlight, a tiny little light in the eye can pick up a huge amount of disease, to more sophisticated things that many of us have in our offices, like devices that scan the back of the eye. But again, we have this tremendous ability to see all sorts of aspects of your health just through the exam. And so it's a superpower. It's a frontline. Optometrists, ophthalmologists who are in the front line and looking at disease, often we are the first people that diagnose many of these problems, and in some cases we save lives. In many cases we save lives by seeing something as simple as what we see on a basic eye exam, which isn't basic because there's a lot of behind the scenes that goes on when you get an eye exam. One of the great things about the first line of defense of eye disease and looking at the eyes and examining the eyes, most of the world sees the optometric and the optometry community who has the big responsibility of making the first diagnosis. And often that diagnosis, there are a lot of different things that can cause, there are a lot of different reasons that you can have a decrease in vision. You can be from the back of the eye, it can be from the front of the eye, it can be brain tumor. Often it's something as common as cataract. And by going to your primary care physician, the optometrist, that person will be able to look at your eye, and they can actually tell you that you may have a decrease in vision from cataracts. Now, the good news about cataracts is that cataracts is one of the most common and fixable forms of eye disease. We can remove the little lens that's in your human lens that's in your eye, and you can replace it with a brand spanking new lens. So it's like, in some respects, instead of having a contact lens that's on the front surface of your eye, it's actually a thicker type of a lens that goes in your eye, and it replaces your human lens. Now, cataract surgery has been around for actually thousands of years. They actually started doing cataract surgery not very well in the olden days. Now we have very sophisticated ways of taking out the lens. We can not only take away the blur that you have from cataract surgery, from the cataracts, but you can also figure out, like, if you have astigmatism and if you have a problem with the front part of your cornea because of the misshapen part of the cornea, you can put in lenses that actually compensates and actually fixes that. So people talk about astigmatism in your glasses, or astigmatism in your contact lenses that you can have to repair, that can fix the astigmatism. You can actually correct for astigmatism with the intraocular lens that you have in cataract surgery. Now, cataract surgery sounds really, it sounds like maybe it's a scary thing because it's a surgery. It's one of the most common eye surgeries that we have in ophthalmology. It may be the most common eye surgery. As a success rate, it is one of the most successful surgeries, not only that we have in ophthalmology or in eye care, but it's one of the most successful and impactful surgeries that there is in all of medicine. I mean, if you think about how well people do after cataract surgery versus other procedures that we have, the complication rates in cataract surgery are extremely low. They're not zero like any surgery, but they're a lot lower than they are than in other fields. And so what's great about it is you can go from not seeing one day to literally the next day after you have the surgery to seeing 20/20, perfect vision. Doesn't always happen immediately. Sometimes it can take a couple days or even weeks for the eye to heal up after a surgery, but often in the case of cataracts, it goes extremely well. Cataract surgery is an outpatient procedure, so this is not something you have to be in a hospital for. It's something that you just go, it's usually a day. You go in and you're out in a couple hours. Some surgeons are so slick that they don't even need to put an eye patch over your eye. It's such a minimally invasive procedure in the sense of, from your perspective. Now, the cataract surgeon has to be incredibly skilled. They have to really know what they're doing. They have to be able to do it in a way that keeps your eye nice and healthy after the surgery. And with most modern techniques, you can do it that way. The thing that's really neat about cataract surgery and that people and taking out cataracts, most people don't realize what kind of health issues cataracts actually can cause. It turns out that that when you get older, one of the biggest causes of mortality or morbidity or getting hurt, getting injured are falls. We always like to ask about falls. And it turns out that hip fractures, which obviously are much more common in elderly, is one of the biggest problems in terms of spiraling down your health. So if you can prevent somebody from having a fall or from having a hip fracture, you're doing a lot for that patient. And guess what? When you have cataract surgery, there has been numerous studies showing that people who have cataract surgery have a lower rate of hip fractures and other falls that they may have had because they can't see very well. The other thing that's really neat about cataracts is from a psychological standpoint, people are less depressed. They've shown numerous times that when you have cataract surgery, after the surgery, often because they see better, their health is better because their psychological and their psychiatric health improve. So it's not just seeing better that your eye doctor can diagnose, but think of it as like this cascade of events. You go into the eye doctor says, oh my gosh, we have a fixable problem. It's because you have cataracts. We change it. But what you don't realize is not only does the cataract improve, not only does by taking the cataract out and by improving your vision, but you don't realize that you're actually improving your health. And it goes back to the concept that by improving your eyesight, by improving the health of your eye, you actually can improve the overall systemic health of the person. And in this case, by removing the lens, by making everything much more clear, not only do you have less falls, and that's been shown in multiple papers and multiple publications, but you also are less depressed and you have more activity. The other thing that's really interesting is that neurodegenerative diseases, such as dementia and other things, people who have cataract surgery actually do better. They're more stimulated. And again, there are papers showing that when after you've had cataract surgery, mentally you're just more alert because you're seeing more. So there's multiple benefits to having cataract surgery if it's right, and that's why you go to your primary care doctor. Your optometrist is one of the main players in cataract surgery because not only do they diagnose the cataract, but as I mentioned, you can put various lenses in the eye that can take care of things like astigmatism. There are some lenses that actually can let you see both near and far simultaneously. And your optometrist, who you've been working with, is the person that really knows you and knows your eye care the best. They know your personality. They know what kind of glasses you like. They know what kind of behavior you have. And that person is the person who can really help guide what sort of lens that you get put in your eye, because you need to have that conversation. Not all lenses are right for everybody. Some people you would not want to put a multifocal lens in. Some people you may not want to put a toric lens. These are different fancy schmancy lenses that corrects problems other than just getting rid of the cloudiness. And by having that relationship with your optometrist and with your ophthalmologist and your ophthalmic surgeon, you're going to get the absolute best outcome. Because if there is something that there's a small thing about your behavior that you really like to wake up in the morning and be able to read the book, okay, read the page. So you might want a lens that's going to allow you to have that benefit. In cataract surgery, you can get some lenses that give you different types of vision. You can get really excellent distance vision, but then you need to use reading glasses after cataract surgery. And that may be perfect. That may be what you want. There are some people who don't want to get rid of the glasses. It turns out that glasses are fashion. Fashion is part of your eyewear, and it makes you, some people do a really want glasses. They don't want to get rid of their glasses. And so that's the kind of conversation that you can have that is part of the optometric, the ophthalmologist, the surgeon. That kind of communication you only get with knowing a patient. And often the primary care physician, the primary care ophthalmologist is taking care of that person, really understands that dynamic. And when you have the wrong lens put in because the person doesn't understand, or because it was a very fast exam and you didn't get time to talk to the patient and really understand what their needs are, that does not benefit anybody. Nobody does well with that. This is a communication, and it's an understanding of what you can do. The other thing that's great about cataract surgery is it turns out that when you have cataracts and you get rid of the, and you clarify the vision, most people really remark that their nighttime abilities really are improved. And so you cannot underestimate, you cannot understate how important driving at night is. And a lot of us have to drive at night. Cataracts often make nighttime driving really difficult. And by improving nighttime driving, you're essentially saving people's lives by essentially making their vision better, because that is something that not only allows them to be safer on the road at night, but it also allows somebody to have more mobility and more freedom. So again, it gets back to that aspect. If you're trapped and you just do not like to drive at night because of your vision, by having cataract surgery that improves your nighttime vision, that is a huge improvement, a huge win for people.
Thank you for watching Open Your Eyes. Be sure to tune in for more informative episodes.